Hi, my name's Christopher Allen. When most people think of CPR, they think of it as it has been seen in the movies, in which the actor gives the victim a few breaths, pumps on the victim's chest, and the victim magically comes back to life. As an EMT and a CPR instructor, I know that this is not the case. For many years, instructors have used certain guidelines for people to follow, which included the method of A, B, C, airway, breathing, and circulation. However, now that method has changed to CAB, compressions, airway, and breathing. Since the method of CPR has changed after many years, today I'll explain the 3 specific steps required to perform adult 1 rescuer CPR, which are compressions, airway, and breathing. Let's start by looking at the first step in CPR. The first step required in performing adult 1 rescuer CPR is compressions. Michael R. Sayer, MD, says that by starting with chest compressions, that's easy to remember, and for many victims, that alone will be life-saving, as cited in Doheny 2010. First, you will call 911. See if the person is responsive. Sir, can you hear me? If they are not responsive, you can roll the victim onto their back. Then, you will place the heel of your hand on the center of the victim's chest. Then place the other hand palm down on top of that hand, interlacing the fingers. Press downward 2 inches. According to Sayer, 100 times a minute or even a little faster is optimal. That's about the same rhythm as the Bee Gees song Stayin' Alive, as cited in Doheny 2010. 1, 2, 3, 4, 5, 6, 7, 10. Now, let's look at the second step in CPR. The second step required in performing CPR is airway. If you have been trained in CPR, you have used the head tilt chin lift to open the victim's airway. The head tilt chin lift is performed by placing the palm of your hand on the victim's forehead and applying firm pressure towards the back of the head to tilt the victim's head back. According to McGraw-Hill, Concise Dictionary of Modern Medicine 2013, with the chin lift, fingers of the other hand are placed under the bony portion of the lower jaw near the chin to bring the chin forward and the teeth almost to the occlusion, which supports the jaw and helps tilt the head back. Lastly, let's take a look at the third step in CPR. The last step required in performing CPR is breathing. Close the person's nose off by pinching it shut with your thumb and first finger. Now inhale normal into your lungs. Cover the person's mouth with yours and create an airtight seal. Administer 2 1-second breaths while watching their chest rise. Continue this pattern of 30 compressions to 2 breaths until paramedics or EMTs arrive. I would like to review. The new method of CPR involves CAB, compressions, airway, and breathing. For many years, the method of ABC was used to perform CPR, airway, breathing, and circulation. With this new method in place, one can clearly see how 1 rescue adult CPR performed within the movies is not accurate. Now, I would like to perform 1 cycle of CPR. Hey, you, call 911. Sir, can you hear me? 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 5, 6, 7, 8, 9, 10. That is adult one rescue or CPR, performed with compressions, airway, and breathing.